of all orthopedic injuries involve upper extremities, as the shoulders or elbows injuries. So I completed a mini review to look at the research that has been done. This research was done in 2020, and my mini review was based on the PRISMA guidelines, which I believe is the gold standard for this type of research. And the inclusion criteria were, I went 10 years back. The participant in the research had to be 18 years and older. I was focusing on upper extremity orthopedic interventions, and I wanted to make sure that the interventions in the research that I was looking at were involving remote physical rehabilitation, either physical therapy or occupational therapy. And the exclusion criteria were I was excluding other systematic reviews, or if the participant had comorbidities that would interfere with the orthopedic diagnosis that I was looking for, or if the research did not involve any rehabilitation specialist. So I appraised all the articles that I found using the quantitative review form and guidelines by Lord and McDermott. So the results, I was only able to find 10 articles that were meeting my inclusion and exclusion criteria. And as you can see on this slide, I'm also going to discuss about some of the limitations that I encountered with my research. A lot of the research were focusing, as you can see, on shoulder injuries and a few on hand and elbow injuries. And the sample sizes of the research that were available, some were very low. It went as low as 11 participants to 71 participants. And also, some of the limitation is the level of evidence of the research that was out there. There were a few randomized control studies, and there were also pilot studies and quasi-experimental studies. Despite all these limitations, the research that I found showed that, out of all of the 10 studies, 2 studies did not show any difference between telerehabilitation and traditional intervention, meaning that they were equivalent. One study found no statistical difference between telerehabilitation and traditional rehabilitation for pain and quality of life. Another study found telerehabilitation to be actually superior to traditional rehabilitation in improving pain, range of motion, quality of life, and function. And 2 studies were equivalent in measuring range of motion of upper extremities. And the last 2 studies showed, high level of agreement between rehabilitation and traditional rehabilitation for measuring pain and range of motion. And all of these were measured in terms of statistical significance with p-values. So a little bit of discussion about what I found was that, the platforms that were used were very important, and actually the outcomes that were targeted. So we found that telerehabilitation based on a video conference showed statistically superior results over outpatient therapy, for instance, for improving pain, quality of life, range of motion, and function. We also found that over the phone telerehabilitation was statistically superior to traditional home exercise program for improving range of motion. Also, we found that video and over the phone telerehabilitation showed statistically equivalent outcome to traditional face-to-face and outpatient therapy for improving shoulder function and range of motion. And finally, telerehabilitation assessment based on video or phone interface, virtual reality interface, and mobile application were statistically significant to traditional measuring of range of motion. So this study was very important, especially before the pandemic, because it discussed, how telerehabilitation can be used for upper extremity orthopedic injuries, and what type of outcome we should target when using telerehabilitation, and how we could use telerehabilitation. And my conclusion and my recommendation was that we need further research, given the limitations that I found in the research. We need further research based on higher level of evidence, um, with specific telerehabilitation interventions, to validate the promising result that I found. And now that we're post-pandemic, I think that we can continue the research on telerehabilitation, mainly to reach out to all these communities where, you know, where rehabilitation specialists are not available. I'm doing research now. I'm planning to do research in Cameroon, where I know that um, rehabilitation specialists are not very available, and I'm planning to tailor rehabilitation to support my research. Thank you.
Dr. Leon, that was just amazing. What a great presentation. And what interesting results, and just thinking about their implications for folks who are unable or in remote areas and can't get to a doctor's office, and what kind of impacts that could have on their health outcomes. Some folks are writing in congratulating you on your presentation. If you would like, please stay in your booth and answer questions, and perhaps share a link or an email where folks could contact you with further comments or queries. So, but thank you so much again.
Sure, thank you so much.
Okay, wonderful. I'm gonna have to go on to the next booth, but great, that was just fabulous.
Thank you.
I'm going to turn off the broadcast now, and which makes it stop recording. But take care.